Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from Health 2025 in sunny Las Vegas. Very excited to be here. It's already been an action-packed 48 hours since I landed. The prominence of this specific show grows every year, and I'm fortunate to be able to host and broadcast annually from here. Rich Scarfo and the entire health team are extremely supportive, and I'm tremendously grateful. Also, make a special note of thanks to Dan Kendall for his support in managing all these health broadcasts and recording. He's been terrific. This is actually my 11th year broadcasting from a healthcare industry conference, and certainly people like Dan and my full-time producer, Roberta Mullen, has helped us just create a top-notch show, but also win 2024 Podcast of the Year. Very grateful for that. And all of my guests for sure there too. For today, though, I have a fantastic lineup of CEOs, CIOs, care providers, policy leaders, and visionaries. If you miss any of this broadcast or want to hear more of This Just In Radio shows, they're all posted at Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and the TuneIn platforms. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but thrive as you navigate your hospital, your physician practice, your company, your community, or even your family through all these changes occurring across healthcare. There's nothing more important, and there's more opportunity than ever before for all of us to thrive. But we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Now, on to my guests. Welcome back to This Just In Radio show, broadcasting live from Health 2025 in sunny Las Vegas. I'm very excited to introduce my next guest, Dr. Rowland Global Chief Medical Officer and Director, Healthcare and Life Sciences with AWS. Welcome to the show, my friend.
Thank you so much for having me. It's a pleasure.
It's been great to meet you last night officially for the first time, but thank you for joining us today. How's the conference been so far for you?
I think the conference has been excellent. I thoroughly enjoy getting together with innovators, technology experts, and of course, old friends, to really talk about the advances and where we're seeing real changes being made to patient care at scale.
Yep. And so I guess what is your, kind of layering onto that, what is your main goal for attending these types of conferences? Obviously, reconnecting students, innovations out there, but even you obviously travel globally. So what do you look forward to when you come to these conferences in general?
Well, I think from the perspective of AWS, so we are the largest global technology provider for cloud, and a large portion of that is healthcare and life sciences. Right. And so our aim is to democratize access to compute, storage, networking, and of course AI at scale. And so these are great opportunities to get together with innovators and the startup ecosystem in particular, where we see a lot of builders building on our platform to develop the next generation of solutions.
Love it. Awesome. What progress are you most excited to see happening in healthcare today or in the industry today?
I think the talk of the town is obviously AI in general. And so we've seen a lot of movement with foundation models, generative AI, and of course the next thing, which is now agentic AI. Yes. So these autonomous software agents which can have tasks which they can pursue independently in a non-linear fashion to achieve outcomes. And I think that will be the next big step in healthcare. We're seeing it come through already in life sciences, but I think healthcare will be the next frontier.
Yeah. So kind of layering on there, what do you think about, what trends should we be looking out, or what are you starting to see? Obviously AI, agentic AI, but what do you start to see as trends over the past year and for the next couple of 6 to 12 months? What should we be ready to navigate?
I think that we're seeing the ability for technology actually to fade into the background, and that may sound odd,
right? Yeah.
But in actual fact, the promise of generative AI in the clinics, actually where clinicians engage with generative AI solutions, things like ambient voice technology and patient record summarization technology, things like that really support care providers to take the heavy burden off them in terms of note-taking and follow-up. And I think what that then allows is the care providers to engage more meaningfully with patients. And so although some of this technology is directed towards the care providers, in actual fact, the knock-on effect on patients where they feel more listened to, they have a real human experience with their care provider, I think that's incredibly powerful. And if you can take that technology and put it in the background so it just works, that is where the goal is.
Absolutely. So I heard something a little, not controversial yesterday, but I'd love your take on this. Right now in a health system, we might have 7 different AI engines, 10, eventually might have 15 to 20, depending on all the different products. A little bit off script here, but what do you think, I mean, from that perspective? Obviously, as AWS has been a significant provider here, what would you say to a health system that has to look at that? The CIO or the CTO, the CMO has to look at that going, I might have, again, 5 today, 7 tomorrow, 10 next year, different AI engines, different, governance models possibly for that. What are your thoughts on that?
Yeah. So obviously we support a large number of, startups across the world. So we, as I said, 80% of healthcare and life science unicorn companies are platformed on AWS.
Yes.
And so we have this large ecosystem who are all building to solve customer problems. Mm-hmm. And so it's a natural evolution of any technology. I don't think that AI is particularly unique in this.
Right.
I think any startup is building to solve a problem. Mm-hmm. And of course, there are many, many problems in healthcare, as we know. And so as a result, there are many different solutions which are competing for attention over many, many different subject areas. So, you think about radiology. So radiology is my interest in particular because that's my background. Yeah. But, in radiology alone, we see a huge number of different AI solutions coming up that look at different areas of even one scan. So there are many different solutions that look at CT scans and look for specific disease entities. As time goes on, as every technology does, I think there'll be mergers, there'll be acquisitions, the best products will survive, others will go by the wayside. And I think there'll be a natural aggregation of solutions together to create suites. Obviously, some of the larger companies, again, so we're very privileged to work with some of the large tech companies like GE and Philips. And we're seeing those companies also experimenting and also buying solutions from some of these startups to create broader platforms. So again, I think this is part of the natural technology cycle. And if you're an organization trying to make those decisions, I think it's really about answering or addressing your most pressing problems first.
I love that. Great answer. So thinking about what trends might be occurring out there, or do you see that we may not hear about tech right now? I mean, I know there's a lot of great things here at Health, but anything out there that we maybe not, we're not talking about, but you're kind of seeing bubbling up, or something that we keep an eye on?
So, as I say, I think the agentic piece we're putting a lot of focus on. So, as a tech platform, we're looking to make it easy for builders to build. Mm-hmm. And so we really approach it in a 3 layers of a technology stack. So at the bottom layer of the stack, we've got our SageMaker Unified Studio, which allows organizations to build foundation models and build agentic agents from scratch. And we're actually building out our own silicon for that as well. Mm-hmm. But then once you've got those foundation models, how you actually put them into production, how do you put them into applications is actually very challenging, because also there are many, many different types of foundation model you can now use. Multimodal foundation models will be a thing of the future. So at the moment, large language models are the flavor, but that's just language.
Right.
But actually there's large data models. So you can put imaging, genomics, pathology models, lots of different types. And so we introduced this Bedrock service, which will allow model choice evaluation, secure customization, and also the ability to build agents on top. So we just launched something called Agent Core.
Okay.
And so Agent Core will allow organizations to build agents on top of their foundation models. And then the top layer of the stack is actually out-of-the-box agents. So we actually, again, very recently just launched Quick Suite, which will enable organizations to take, it's a fully managed agentic platform. So, and actually Amazon are using that themselves. Mm-hmm. So we're actually got access to it. And so you can actually put data into the platform and actually build agents yourself in a no-code way. So putting that technology into the hands of end users and not making it a technology problem is a really important democratizing effect. So that's what we see that the direction of travel will be, is really allowing greater access across the whole ecosystem.
Yeah, I think you answered my next question a little bit there, but diving in deep, my main listenership are CIOs and health system or CTOs, and a lot of them, they've started some of their initial models with AI and deploying AI for great use cases. what would you say to the average, and like we talk about Rasu, he's obviously on the kind of the cutting edge, and
Absolutely,
like John Halanka, they're doing phenomenal things with their
Yeah.
organizations. But for smaller organizations, mid-sized organizations, where would some of those start? And obviously, find simple use cases and start there. But what best practices would you offer to them, or say, hey guys, this is a great way for you to start with? They might have a little bit less resources and stuff like that. What's a good strategy? Some thoughts there.
Yeah, so again, we work across the whole spectrum of health systems, from academic medical centers that are building and managing their own models to small health systems that want very much managed services, because their job is to deliver healthcare, not necessarily to innovate and to build. And so again, we work very closely with our partners in that space. So for instance, Innovasa have just released their agentic platform called Gravity. And so that is a partner that is building out these agentic flows from scratch, and they can work with these smaller health systems to really see where they can innovate. Again, choosing your battles is really important.
Absolutely.
And so the smaller health systems may not want to go into the clinical domain initially, because again, that's a very heavily regulated space, as we all know, and getting over those hurdles, making sure FDA clearance and everything is watertight, is a non-trivial task. And so often those systems want to start with a more operational based workflows, and actually how they can bring some of this technology to improve operational efficiency. So for instance, we've been working with health systems in Texas to manage their call center operations. And so just by bringing in an automated call center and patient engagement platform, they were able to reduce they had 1,800 patients waiting for appointments. They were able to reduce their backlog by 60% in 3 months, just to move to a more automated call center and patient engagement platform. And I think that's a very exciting piece of efficiency, especially when centers are under incredible cost constraints and driving, a lot of health centers are being asked to reduce their costs by 10% over the next 3 years. And that's an incredible thing to try and do. But I think with the technology that we're now seeing coming into the market, that's achievable.
Fantastic. Love that, and thank you for that. So thinking beyond today, what's really something that we need to be ready to navigate and kind of on your proverbial crystal ball in the next 2 to 3 years? So maybe we're not talking about, we have not quite seen here at Health, we may not see it at Vive next year, but what's something we need to think about for 2 or 3 years from now?
I think that automation, I think we're just starting to see the agentic AI coming in to healthcare, but it's already in production in life sciences. I think we're going to see an explosion of in production healthcare use cases for agents. And I think it will affect every step of the patient pathway, from the operational side to patient booking, finding the right appointment, finding the right clinician, all through patient care and follow-up, and also linking patients to research. So I think there'll be much more merge between the life science space and the healthcare space in terms of clinical trials, clinical trial matching, and the ability to really deliver a much more bespoke kind of treatment to patients in the future. And we're seeing that come through now. It'll really take off in the next 2 to 3 years.
Love that. I'm going to do a follow-up with a little bit more controversy. EHR, for the most part, is the source of truth for a lot of our health systems.
Yeah.
There's obviously, with what's happening with AI, and we know in the opportunity, we've seen glimpses of it. Where do you think the EHR will obviously always be its essential component, but do you see now an expansion past the EHR as a source of truth? And
well, I think we're already seeing an expansion beyond the EHR as a source of truth, because there are many other data sources that are necessary for patient care. As I go back to one of my original comments, which was about there are different types of data available. So it's not just text data from the electronic medical record. There's also genomic data. There's also ambient voice data, there's biometric data, pathology data, imaging data, as well as wearable data. So I think there are many, many different data sources. Now, the electronic medical record is definitely a system of record.
Right.
The question is, what other things will be running on top of that system of record in the future? Yeah. And certainly the current administration in the US is very focused on opening up agentic marketplaces where, agents will be working on behalf of patients, leveraging that electronic medical record data in order to try and drive better outcomes. And so I think there's a whole opportunity to expand the ability of electronic medical records from being static, being repositories, to much more engaging, both with patients as individuals as well as health systems themselves.
Love it. Excellent answer. Rowland, Dr. Ewing, thank you so much, my friend. Good to have you here.
Absolute pleasure.
We'll talk to you soon. Thank you. Welcome back to This Justin Radio Show, broadcasting on the tail end of Health 2025. Very excited to introduce my final guest from the conference, Jonathan Bush, founder and CEO of Zeus Health. A big welcome to the show, Jonathan.
Hey, Justin, I'm glad I'm on here with you.
You got it, my good friend. So great to have you. So obviously you want to hear a little bit about Zeus Health. Today will be a little bit just shortened just because we have a lot to cover from the conference and what's happening in healthcare in general. But before we dive in, how you been doing? Always great, I assume.
Everything's marvelous. In fact, I've picked up a new hobby. I'm running for governor of Maine. We're going to go from timber mecca to health tech mecca in 8 short years. No,
Yeah,
we are going to bring a little more American dream energy to Maine, which needs it badly. It's not as rich a state as it deserves to be. But Zeus is exciting, and it's so exciting, in fact, that I can run for governor of Maine. We're kind of closing in on 10 million records in our national common patient record. It's really the only API first, fire native, always on common patient record. And it was a lot of work and a lot of money and a lot of time to build it. But now it becomes an attachment point for all longitudinal care. One of the things that I think is about to happen is just as I saw all the little fractile pieces associated with dealing with claims turn into this sector called revenue cycle management, RCM, I'm seeing the emergence of a new sector called LCM, longitudinal care management. And LCM, of course, the atomic unit is a life, whereas RCM, the atomic unit, is an encounter or a claim. And I think the money to be made going forward, it's not that you won't have to do revenue cycle management. It's not that you won't have to do risk adjustment or make your contract comply with the quality measures you agreed to. But the thing that will make you money doing good things is managing when and how and where people get care by being closely attached to lives, to patients. And so the idea of a platform that doesn't care what, this was an in-person encounter where you took your pants off in the doctor's office, and this was a tweet, or a check-in from your Aura ring, or a smart drug that sent out a signal saying, okay, he swallowed me, whatever it may be. All of these next pushes will require some common version of truth that's always on, that speaks everyone's languages, and that performs well on a myriad collection of software platforms. And I think that's very exciting to see that that's starting to happen. We've certainly been talking about it long enough.
Absolutely. No. And so that's kind of leads to my first question. You just covered it pretty well, but
I'm blathered on for 10 minutes before your first question.
No, I love it. You're great, Jonathan. And you absolutely will do Maine very well. I have no doubt. If anybody can do it, it's absolutely you. What progress are you most excited about seeing in the industry today?
I think the tipping point into accountable care, and I don't mean accountable care as a code word for jacking people's diagnoses so you can charge more in risk adjustment. I mean actual accountable care where you are accountable for the care across a myriad of providers. Seeing now we're well into the majority of Medicare lives are in Medicare Advantage plans, seeing the spike in the number of Medicaid lives. Frankly, tragically, the pressure on Medicaid, will have a silver lining, which is states will stop lying back and saying too complicated and lean in on managing Medicaid. I think that'll be great. And I think on the commercial side, companies like Firefly and others that are saying, hey, I'll be a 50-state virtual Kaiser for you, right. Not just a health plan, but a provider. And then they become the curator of 1 million of these specialized focused factory experience. I'm going to put all my diabetics over here. I'm going to put all my, folks that need to rehabilitate from an injury onto Sword. I'm going to put all my folks with diabetes onto Onduo or whatever it may be. That orchestrated shadow network, national health system that sits in the shadows of the big hospitals, and the big drugs. Yep. We've got 5,000 hospitals and about 300 drugs, that are sort of used for everything. and we're growing a whole ecosystem of narrower, more virtual, lighter lift, more targeted drugs and interventions that need to be connected.
Yep. I love it. No, you're onto something there for sure. So following that train of thought, where do you see the trends in healthcare today?
I think the big trend in healthcare is towards longitudinal care.
Yep.
You know, you used to be able to say, oh yeah, we'll get it out. You know, having an ACO meant you having a bunch of coders go do risk adjustment on your claim file. You know, that's not accountable. I mean, that's a thing, you know, you don't want to be screwed if you're going to go at risk. But I think the migration into actually managing it, you know, I was sad to see everybody was making money on that sort of wake up broke one day or wake up with no upside one day, Agilon and all those poor guys, you know, getting clobbered in Humana. But what I like is that that's evidence that that first air pocket's been pushed out of the lung, you know, and now we're going to get into the actual managing down of hospital days per thousand and use of exorbitant drugs. And that's what's exciting is I'm seeing that happen now. I'm seeing major employers, mainstream employers say, you know what, I'm not getting rid of United, but I'm adding, you know, Firefly. I'm adding one of these targeted, fully loaded with all of the new inventions. Remember that old line, you know, the future's already here. It's not evenly distributed.
Right.
You know,
Absolutely.
we're starting to see it get distributed.
You're right.
We're starting to see it make its way from a bunch of kooks on either coast out into mainstream America, into mainstream benefit plans, into, you know, hospital days are going down. We're seeing hospital days for 1,000. When was the last time that happened?
Right.
You know, pretty exciting.
So following on that, how would you tell the average, I guess, company, CEO, even patient, how could they explore that more? How do they get engaged in that better? What questions should they ask?
There are, of course, some pretty cool, one of the accelerators of this is there's some pretty cool consumer facing for the, you know, this is sort of a barbell thing. You've got a pocket of really, really unwell chronic disease, behavioral determinants, social determinants, patients that drive most of the cost that need this stuff. And then you've got a pocket of folks that don't need anything, but they're always wanting more, you know, frankly, our kind, you know, with our Aura rings and our our whoops, and I'm measuring, oh, I had 32 more calories today than yesterday, you know. And both groups are pulling the bulk, you know, out of indifference and into online care. So the regulatory environment right now, did I just lose you?
No, you're here.
Oh, good.
Yep.
Disappeared from my screen. The regulatory environment favors the left side, obviously the folks that are huge drivers of cost. So, you know, if you're a hospital and another provider, even an online provider, needs data on one of your patients today, you can get fined if you don't deliver it.
Right.
You don't get fined if, you know, some bougie guy with an Aura ring asks for his data, you know.
You're right.
Someday the bougie guy will get it too. Yeah. But what's exciting for me is today in the treatment use case, it's pretty much accepted that unless you have a letter from your mom, you know, the hospitals are going to share their data. And it's happening. You know, we're into the 50, 60 million records exchanging now a week. So the shit is flowing.
Yeah, and I'll give you props too, because I mean, I would still work with your former company, Athena, a lot, and what you built there for the ecosystem. Well, you single-handedly unleashed millions and millions and millions and millions of records and created an ecosystem of innovation in our industry. So I want to give you props because you spearheaded a lot of that. And I remember those days, you know, 10, 15 years ago, 20 years ago.
Well, you weren't sleeping over at Greenway. You were wide awake. The Green family, those guys, you guys were terrific.
Yeah.
And I think we did make it fun to bring fun enough to be in healthcare that smart people left the important work of, you know, porn, gambling, and social media to do other things on the internet.
That's right.
And that chapter is now normal. You know, talk about futures already here, not evenly distributed. Like, it's now normal for people with tech chops to be in healthcare, which when we were lads, I mean, we're still
lads. Yeah.
Was sort of weird. You know, it was sort of the true believers who weren't that smart or sorry, it was either the true believers who were sort of quasi-socialists or people who just weren't that bright and this is the best they could do. And now it's like, no, you can be a totally selfish engineer who really just wants to do the best work and make the most value, which by the way is healthy. I'm not against that.
Yes. Oh yeah.
And still be in healthcare.
Absolutely. Yep. So in our closing minute and a half or so, what looking to the proverbial crystal ball, and I'm actually going to have you back. I want to have you back as soon as possible. We have so much to talk about. Day. But tell me about, and looking at the proverbial crystal ball, what trend we need to be ready to navigate in the next 2 or 3 years that we may not have seen out there on the stage or talking about right now?
I think the trend that we've been talking about in this segment is this notion of always on care. Everything, initially it's a parlor trick and there's, oh, look on Duo, Verily lets you do free primary care, but as that sort of hits the bulk, the mass of data, everything in the stack needs to change. I mean, today we still use the word interoperability as if, I've got a reality over here and you've got a reality, and I lift up a copy of my and throw it over a wall. That's not going to work, right? We're going to go from interoperable to API first, common patient record, common data, where two people who don't know each other, who aren't friends, could be enemies, are going to read and write collaboratively on the same logical object, on the same records. And that is happening. That is what we've got to watch. When you build software, you should build it on a common patient record today. If you have software, you should make that software be able to live on a common patient record. The notion of lobbing CCDs or faxes, is coming to an end. And, you don't have to go first, but you definitely don't want to be last.
Right.
And I would say in the coming year or two, that's going to be the inflection that people need to watch.
I love it. I think you're spot on. I've already seen some of these companies bubble up. So I know you're absolutely onto something there, Jonathan. It's great to have you on air. We will absolutely have you back. Godspeed up there. I know you're doing great work up there in the Northeast in Maine, and love what you're doing, my friend.
Well, thank you for making healthcare interesting. It's not easy.
You got it, Jonathan. We'll talk to you soon, brother. Appreciate it.
Cheers.